Hello, hello, hello. It's lecture time again, guys. We're still talking about junctional rhythms in chapter 9. Here we see where the AV junction is located. Notice our SA node is here in our right atrium. And then our AV junction and our AV node, okay, and your right ventricle. So that AV junction is located between your right atrium and your right ventricle. Let's talk about the pacemakers of the heart. The SA node is pacemaker king, okay? Your SA node is your normal pacemaker, and it keeps the heartbeat between 60 and 100. And then here we see with the AV node or the AV junction, it's our second pacemaker of the heart, and it keeps the beat of 40 to 60 beats per minute. And then down to the ventricles, which is the third pacemaker of the heart, and its heartbeat is less than 40. The P waves in junctional rhythms. So we know normally your P wave is seen before the QRS. However, with junctional rhythms, your P wave can be inverted. It can come after your QRS, or it can be hidden within the QRS. Okay? Junctional rhythms or junctional escape rhythms occur when the SA node may fail or to generate an impulse, or the rate falls below that of the AV node, and then the AV node assumes the role of the primary pacemaker as a safety feature in order to save the patient's life, okay? So what are escape beats? An escape beat is a safety mechanism in the heart which functions when the SA node fails to fire an impulse. So if we didn't have those secondary pacemakers, we would be in trouble if that SA node failed. They are the result of depolarization in other locations of the heart, which cause the escape beat. And when the AV node depolarizes, the current travels upward into the atria and then downward to the ventricles along the normal conduction system. So junctional rhythms can be escape rhythms or the result of usurpation. Your junctional escape rhythms or your junctional bradycardia, and then junctional rhythms in general tend to be escape rhythms, okay? Usurpation rhythms or your PJCs or premature junctional complexes and junctional tachycardia. And then with the accelerated junctional rhythm, it can go either way. It can be an escape rhythm or it can be a usurpation rhythm. Here we see an illustration of that. Your sinus rhythm, you see your P, QRS, and T. And then all of a sudden, something goes on with the SA node and you have the AV node taking over. And here we see where we lost our P wave. Okay. So what's going on at the junction? Well, the SA node is the pacemaker of the heart. An electrical impulse begins in the SA node and then continues to the AV node. So if something happens with your SA node, it becomes sick, it fails, then your AV node jumps in and takes over in an effort to save your life, okay? So that's what goes on at the junction. The characteristics of your junctional escape rhythm. Your rate's going to be 40 to 60 beats per minute. The regularity is regular. Your P wave may be inverted, appear during or after your QRS. The QRS is going to be normal, and your PR intervals, if they are present, will be shorter than normal, and your QT interval will be within the normal range. Characteristics of the premature junctional complex. The rate depends on the underlying rhythm. The regularity is irregular due to the early beat. The P wave can be inverted, occur before or after the QRS, or be hidden within the QRS. Your QRS complex will be normal. Your PR interval will be shorter than the 0.12 seconds, and your QT interval will usually be within the normal limit. Now we talk about the regularity as far as your PJC. It can also be regular but interrupted, okay? Junctional tachycardia, your rate's going to be between 100 to 180. We know anything with tachycardia is greater than 100. The regularity is usually regular, and then your P wave can be inverted, appear before or during or after your QRS. Your QRS complex is normal, and your PR interval, if present, will be shorter than normal, but your QT interval will be within the normal range. So here we have a patient with junctional rhythm. Some of the causes of junctional rhythms include coronary artery disease, myocardial infarction, heart surgery, some drugs like digoxin, and your electrolyte imbalances. And then we set our AV, we get those junctional rhythms. If the SA node is damaged, your AV node takes over. And some of the symptoms that patient may have is feeling really dizzy or weak because they don't have enough cardiac output getting out to the body, okay? They might experience chest pain or shortness of breath, feeling really tired, and their blood pressure may be low. That's all I have today. Your assignment is going to be to list 5 facts that you learned about junctional rhythm. And I will see you guys next lecture.